First of all, mandate policy should be like all effective public policy. It should be based on evidence. Fortunately, we have a little bit of an evidence base. So it shouldn't be wisdom based. It shouldn't be based on initial political instincts. It's natural and appropriate in democratic societies to start with what kinds of policies that you find that are in line with a particular government's inclinations. But look at the evidence. If you have a mandate or a requirement, for example, in the US context, and you make it a little too easy to opt out of that mandate, people and states and jurisdictions have higher rates of exemptions and vaccine refusal, but also have higher rates of vaccine preventable diseases. On the other hand, there is recent evidence that if you make it too strict to opt out, you have what we call a replacement effect, where people find other ways, like homeschooling, like medical exemptions that are not always appropriate medically, to avoid the consequences or the restrictions proposed by these kinds of laws. When you have a situation where you have a mandate, but it's hard to opt out of, but there's still a choice or a perceived choice that parents have. And in those kind of situations where, for example, if you want to opt out of a mandate, you have the option of going to a physician who talks to you about the risks of non-vaccination, the consequences for the child and the community around non-vaccination, and so on and so forth. That has an impact on reducing the rates of vaccine refusal. But also, it is very ethically appropriate because a lot of the discussion is around parental choice and liberty. What better way of ensuring choice, true informed choice, where a physician is telling you about the consequences of your actions? And so therefore, these kinds of quote-unquote restrictions strike that balance, the balance of convenience between opting out and putting a child, an individual child, but also other children at risk, versus having no choice. So these kinds of things are more pragmatic, they work, and they garner broader support.